The VisuMax is a femtosecond laser system designed and manufactured by Zeiss, headquartered in Germany. It is used in ophthalmic surgery, particularly for corneal refractive procedures, and was FDA approved in 2024 and CE marked in 2006. With a price exceeding $90,000. Its dimensions of 3.8 by 4.40 meters make it suitable for surgical environments. The VisuMax Femtosecond laser system is designed for corneal refractive surgery, a vision correction procedure that reshapes the cornea to treat myopia, hyperopia, and astigmatism. The laser performs vision correction in a single, minimally invasive step and creates a lenticule, a thin, disc-shaped piece of corneal tissue, and a micro-incision smaller than 4 millimeters in the surface of the cornea. Through this small opening, the lenticule is gently removed, changing the cornea's curvature to correct refractive errors such as myopia or astigmatism. It emits light at a wavelength of approximately 1043 nanometers, with each pulse lasting between 220 and 580 femtoseconds, with each one carrying under 300 nanojoules of energy. Once the lenticule is extracted, the corneal shape is permanently altered, restoring clear vision. The SMILE procedure, performed using the VisuMax femtosecond laser, represents a significant advancement over conventional LASIK surgery. While LASIK requires a large corneal flap with a side cut of about 20 millimeters, SMILE achieves the same refractive correction with a tiny incision of just 2 to 4 millimeters, which is an 80% reduction in incision length. This also results in a 30% smaller cap incision area, preserving more corneal tissue and reducing the risk of postoperative dryness. Traditional laser platforms create high suction, temporarily compressing ocular vessels and reducing retinal blood flow. It uses a gentle, curved contact glass that conforms to the natural shape of the cornea, distributing pressure evenly and maintaining normal ocular perfusion throughout the procedure. First, the posterior cut defines the lower boundary of the lenticule, followed by the side cut, which outlines its edge. The cap cut then forms the thin corneal layer above the lenticule, and finally, a micro-incision just a few millimeters wide is created for lenticule extraction. The shape and thickness of this lenticule depend on the patient's refractive correction needs, such as for myopia or astigmatism, and are precisely calculated based on the curvature of the optical zone and the cornea's refractive index. This ensures that the tissue removed perfectly matches the optical power required for vision correction, achieving extremely smooth and accurate results without the need for blades or thermal energy. The small, curved contact glass matches the natural contour of the cornea, ensuring gentle fixation without deforming the eye. Unlike older laser systems, it does not use a separate suction ring and never contacts the conjunctiva, eliminating the risk of subconjunctival hemorrhage. By maintaining a stable, low-pressure environment, the interface allows consistent laser focus, while preserving normal blood flow and avoiding discomfort. This design provides both surgeons and patients with a smoother, safer experience, combining mechanical stability with minimal physiological stress to the eye. When comparing SMILE using the VisuMax system to traditional LASIK, both procedures deliver excellent long-term vision results, but differ in their healing dynamics. SMILE recovery is slightly slower in the first few days, while LASIK often stabilizes in 1 to 2 days. However, SMILE's 2 to 4 millimeters micro-incision preserves the corneal integrity far better than LASIK's 20 millimeters flap. Patients undergoing SMILE can safely return to sports within a week, compared to the 2 to 3 weeks recommended after LASIK. The long-term effects of SMILE using the VisuMax system compared to LASIK reveals that SMILE results in only about a 10% loss of corneal strength, while LASIK, by 30% dry symptoms, are less frequent with SMILE, about 50 to 70% lower incidence. But LASIK has a higher rate of dry issues. SMILE provides stable refraction lasting over 10 years and minimal regression. LASIK also delivers very good long-term vision outcomes, but it carries a higher risk of regression in patients with high myopia.